Hello, everyone. Welcome to Mom's Corner. Oh, okay, yes. Hello, everyone. Welcome to Mom's Corner. I hope everyone's doing well today. My name is Zainab, and thank you so much for being here. For those who are regulars or Mom's Corner, thank you for coming. And for those who are joining us for the first time, welcome and thank you. Before we proceed, we will have the link to the stipend at the end of our session today. And so please be on the lookout for that. It is a participatory stipend, so I encourage everyone to participate however they're able, either by opening your camera or sending questions and comments to the chat box or just using the emoji features. And do please change the name on your screen to reflect the one that we'll be sending the stipend to so that we have the correct one. And if you need help in doing that, I can certainly help you with that. A brief introduction of Mom's Corner. Mom's Corner is one of the many programs under the umbrella of Global Prenatal Services, or GPS. And GPS is a nonprofit organization doing amazing work and changing lives every day. Our mission is to provide perinatal support services that include doula services, lactation education, childbirth education, early parenting support, and child development. The communities we provide those services to are marginalized communities, which include Black, immigrant, and refugee families. And Mom's Corner is not just a space for moms, but for all women folk, because at GPS we believe that motherhood is an extension of a woman's identity and not the definition. And Mom's Corner, since the pandemic, has become not just a space where we come together to find camaraderie, empathy, support, but really a safe haven and access to so many critical resources in our communities. And we will have a question and answer after the presentation today, but if you have any questions or comments anytime during the presentation, please feel free to interrupt and ask our amazing doctors. And we're so grateful to have them here today. This is their first time, so we're going to make them feel welcome. And I encourage all the members to please ask all the questions you would like, because this is a safe and judgment-free zone, and all questions are welcome and encouraged. And so without further ado, I will pass it on to our doctors. Thank you, guys.
We can go ahead and introduce ourselves first, and we can pull up the presentation. But hi, everybody. My name is Seema. I originally grew up on the East Coast in New Jersey and then moved out here to Seattle about, I guess, a year and a half ago. I'm in my second year of our residency training program at Swedish First Hill. This is my cat that you might see popping in and out of the video. And really excited to be here, and just want to echo, please, during our presentation, feel free to interrupt and ask any questions you have.
Hello, everyone. My name is Tara. I am in my first year of family medicine residency at First Hill. I actually grew up in Iran and went to high school and a year of college there, and then I moved to the US. Feels like ages ago, 15 years ago. I was in California first, doing school, working, went to Boston for medical school, and then now in Seattle for residency. I am very excited to be here. Thank you for having us. Sorry, having technical difficulties. You can all see my screen, correct? Okay. So today we are going to talk about some newborn skin conditions. I personally am usually scared of rashes, but you're going to see there are a lot of them that are not going to be dangerous or something serious when you see it in newborns. So these are the conditions that we're going to review together and look at some pictures. Newborn dry skin, milia, congenital dermal melanocytosis, which was formerly called Mongolian spots, erythemotoxicum, jaundice, baby acne, cradle cap, eczema, heat rash, and diaper rash. So we're going to start with this one. So just looking at these really cute babies. You can see dry skin. That's very common in newborns. So thinking about it, the baby is in the uterus for about 9 months, surrounded by a lot of fluid. So it takes a while for the baby's skin to get used to the new surroundings. Dry skin is really not dangerous, and you can put lotion or oils on them, but you really don't need to do anything about it. So not doing anything is completely fine, and it will get better by time. So I can, sorry, meant to go back. Looking at this is just dry skin, and you can see it usually in the back and on the extremities, like on the arms and on the foot and the legs.
This next skin condition is called milia. And you can see in these photos, there's kind of these little tiny spots often around the nose and on the face. And this is also something that is not at all dangerous. On the next slide, we kind of have a descriptions. Like I said, they're usually white in color, although can kind of appear to be different colors depending on the skin tone. Usually on the face, and there's absolutely nothing that you need to do. These are often can be present even from birth, and can continue onwards, and they usually just end up going away on their own.
Sorry, is that baby acne? That's also referred
This
to.
is different than baby acne. Yeah, baby acne, and we'll get into more detail about that, but it usually is kind of looks a little bit more significant, where milia is usually, it's not usually red like sometimes acne can get, and they're actually just very, very tiny. So you can, in this bottom left hand picture around the nose here, you can see it really well. It's just these tiny little white spots, usually not any red surrounding it.
So this one, you can see it sometimes from the for when the babies are just born, and then they can come later and they have different sizes. As you can see, some of them are really small, some of them are larger. These are called congenital dermal melanocytosis. That's a handful. And these are gray blue patches. They look like big bruises, so sometimes people get scared, but they don't hurt, and the baby's completely okay. It is commonly in the back, in the bottom, and on the legs, and it's because of the differences in skin color in different parts of the body, and it's perfectly harmless. And they range from the size of a pinhead to 6 inches across, and really benign condition.
Sorry, I don't, am I the only one? I'm not hearing anything.
I can't hear
Sorry.
Dr. Doshi
I'm
either.
so sorry. Thank you for letting me know. I was still muted, my bad. This next one that I wanted to talk about is called erythema toxicum, and it kind of has a scary sounding name because it has the word toxic in it, but it's actually very, very normal, and not harmful to the baby at all. So if we go back a slide, we can look at the picture of kind of typically what it looks like. Yeah, I actually think, yeah. So on these kind of left pictures, this kind of diffuse redness, it can be present kind of all over the baby, not necessarily in one spot, and can sometimes have this patchy or confluent appearance to it. And this is something that can be present starting at birth, and then also kind of typically over time will go away. And Tara, if you could go to the next slide about the description of it. It can be present at birth and can kind of develop up until 2 to 3 days after birth. it can be raised. It also can be flat. And like I said, it's a normal baby rash. It does not cause any problems, and there's also nothing that needs to be done about it. I think sometimes it can feel scary because it's like red in color, but is a normal, like normal healthy thing to have.
I think we have also done a bad job naming it something that has toxic in it, so it is scary. Okay, so this one, which is very common, if you look at all these photos, the babies look a little yellow. So this is baby jaundice. This is also very common. Um, so usually it's seen in a few days after birth. A lot of babies go with jaundice to from the hospital to home, but babies usually have really soon follow-ups with the doctors, and the doctors will check the blood for bilirubin level to make sure that the bilirubin is going down. And bilirubin is just a product of our red blood cells breaking down. But sometimes the baby is not able to do that. So if a baby after going home like becomes more yellow, or you can actually appreciate some yellow color in the eyes, or if you press on the skin and you can see like that the skin after you press, like it's very yellowish. Or if the baby cannot pee, you don't actually see a lot of wet diapers, or it's really hard to wake them up, even for feeding. That means that they have jaundice and they're not able to get rid of this bilirubin. So you have to call the doctor, take them to the hospital. And one thing that they do is they do phototherapy. They just put them under this light. Sorry, wrong direction here, like that last picture, the blue one. They cover their eyes, they put them under the light, and what they do is they try to figure out what's going on. Is this baby yellow because it's not feeding well? Is this baby yellow because mom is not making a lot of milk? Or is this baby not getting enough milk because it's not able to latch? And then what they do is like they usually like try to like counsel mom on like breastfeeding, or sometimes supplementing with formula. Sometimes if the baby's too dehydrated, giving them a little bit of IV fluids, and then just leaving them under the light for about 24 hours, weighing them and making sure that the bilirubin level is going down. And I think we might have questions in the chat. I'm gonna just quickly take a look at it. Yeah, so how long did it last? Faduma is telling us that her son had jaundice. Did they need phototherapy? A few weeks, okay.
Doctor, I wanted to, I know some adults who also present this problem later in life. How is that different from this one?
So usually when someone is jaundiced, there's a problem with the liver. So there are different reasons for jaundice. Some people have, hepatitis, they can be jaundiced. Some people have like alcohol use disorder, those people can be jaundiced. Some people have autoimmune liver diseases, they can be jaundiced, or something systemic in their body can be wrong, and then there is fluid going back to the liver. So anything that upsets the liver to the point that like it's not working very well can cause jaundice.
And with babies, is it just overproduction of the jaundice with babies?
So with babies,
bilirubin, yes.
No. It's usually that, but it can have different reasons. The most common reason is because the baby is not feeding enough. It's a breastfeeding problem. But sometimes it can be because the blood type of mom and baby is different, and that can cause a reaction in the baby, and baby's not able to break down the blood cells, the hemoglobin in the blood cells, that can cause that. Sometimes there is some enzyme in the liver. It's very rare, but it can be like the baby doesn't have the enzymes in the liver, that can cause jaundice as well. But sometimes the babies are not able to break down the milk protein that can cause jaundice as well. But the most common cause, especially at the beginning when the babies are born, is because they're not feeding enough.
Oh, wow. Okay.
They're dehydrated. Yeah.
Thank you for that.
Of course.
Just
Let me
to,
see.
sorry,
Oh, sorry. Go ahead, Seema. I just wanted to see if there's a question or someone just continued that conversation. Go ahead.
I was just gonna share that Tara and I actually the other day admitted a baby to the hospital because they were very jaundiced and needed this phototherapy. And I think there are different risk factors that make a baby more likely to have a high enough level that they need to go to the hospital. Sometimes it's for genetic reasons. If like you yourself, when you were a baby, needed this, that puts your kid at higher risk. Or if your new baby has a sibling that needed phototherapy, it's a higher likelihood that the baby's going to need it. Also, if the baby is premature, their liver isn't fully able to process all of that bilirubin, so they'll be a little bit more likely to have this. And the advice we normally give in the office is that you know your baby best in terms of what they look like. So if you feel like, this is like the skin color is looking different than usual, I think it might be more yellow. It's always great to just bring the baby to the doctor, and they can also assess and see if they would recommend checking the level and then going to the hospital. The blue lights that the baby are under are very safe. We see this a lot in the hospital, and there's the bad side effects of it are very, very rare, and so it's a very safe thing, and it works really well. This baby that we admitted to the hospital, I think within probably excuse me, within 12 hours had a normal level and was able to leave the hospital. And the reason it's important to go to the hospital is because if that bilirubin keeps building and getting higher in the baby, it can cross into their brain, and then can be really dangerous for the baby. So we try to be proactive about doing the phototherapy.
And I think something that was, sorry, go ahead.
Oh, no,
Someone had a
please.
question.
Yeah, I
Go
was just
ahead.
going to ask about the phototherapy. What is it supposed to be doing? Is it kind of regulating something? Obviously, something is out of dysregulated in the body. So is it mimicking like the sun?
So the chemistry of it is we have this bilirubin that is made before it gets to the liver. In the liver, we have this enzyme that changes this bilirubin to a different type of bilirubin that our body can pee it out. What happens with the phototherapy is like it activates those enzymes to work better so that bilirubin, before it gets to the liver, is converted to the bilirubin that is inside the liver, and then we can get rid of it. So it helps those enzymes.
Got it. Thank you.
And something that was interesting is, I mean, this baby looked very yellow, but also mom was telling us that she couldn't even wake her up for feeding. Like she was super tired. And when Seema and I were like examining the baby, the like the arms were just very stiff. It wasn't like any baby that I had seen. But as Seema said, in like about 12 hours, the baby was fine and they were able to go home. Yeah. And I think something that I learned that day is mom was using these nipple shields that I had not seen, but it wasn't placed very well on the breast and the baby was not able to latch very well. So I think baby had a hard time latching and was getting tired because the baby was trying to actually breastfeed but couldn't. Okay, let me go to the next one.
Yeah, this next one that we have on the slide is baby acne. So if we look at the picture, it looks like very similar, honestly, to adult acne of just having these pustules kind of on the face. And this usually develops around 2 to 4 weeks of life. And the reason that babies get the baby acne is actually because of the mom's hormones. and it's totally normal. They're harmless. It won't leave any scarring and eventually kind of goes away on its own. There's really nothing that you need to do to get rid of it. It will just, as the hormones are kind of leaving the baby's body, will clear up on its own. And then other names that you might hear your doctor say for baby acne, it can also be called infantile acne or neonatal acne. Something that we always like to mention is some families have like little like photo shoots planned for their babies after they're born. So just to keep in mind that around 2 to 4 weeks of age is when they start to pop up. So you can plan, if you're doing a photo shoot, you can kind of plan it around that time if you care about that.
Good point. I never thought about that. Okay, this one is something on the head. This is the cradle cap. It's very crusty, oily, scaly patches on the baby's scalp. It looks very like when I look at it, I'm like, wow, this is something serious, but it's not painful, it's not itchy. Babies can have like a thick white or yellow scale, and it's not easy to remove. Usually it clears up on its own in weeks or sometimes months. And the first recommendation is washing your baby's scalp like daily with a mild shampoo, which is supposed to loosen and remove the scales. Sometimes people have like these combs that they use. Sometimes people put like petroleum gel and then use the comb. What you shouldn't do is scratching it. And then if you wait for weeks, months, it doesn't go, there are some medicated shampoos or lotions that can be used. Let me go back. Yeah, and I try to have like different ones, like the first one on top left. That one is not as bad as the one at the bottom, but they all are very benign and not painful at all.
And I see, Taylor, you mentioned that breast milk help with your son's cradle cap. That's so awesome. Yeah, breast milk has a lot of anti-inflammatory and antimicrobial properties. It's really amazing. So honestly, with a lot of these rashes, I have anecdotally even heard for like the acne, moms putting their breast milk, and that often for many of these can help it go away. This next one that is on this slide here is eczema. Another name that you might hear for eczema is called atopic dermatitis. And it can present basically as these spots of dry skin on different places on the baby's body. It can happen in the first weeks of life, or sometimes it doesn't develop until the baby is older. It's possible kind of even when they're toddler stage, that is might when it will flare up. And this can be, it can get sometimes red and irritated. The best thing to do that helps prevent these flares is to keep the skin well moisturized. So we recommend applying Vaseline or any kind of like thick moisturizing lotion, and doing that as soon as, if you're giving the baby a bath or when they're, a toddler, as soon as they come out of the bath, instead of really with the towel drying them clean, just kind of patting them so some of that moisture from their bath is staying on their skin, and then applying Vaseline when they get out of the shower too. And then in order to kind of prevent the dryness, is also trying to avoid a very hot bath, more kind of normal, like mild temperatures. Usually with these, applying these like thick moisturizing creams and trying to keep that moisture in, that usually does the job. Sometimes there's some babies that if they have more severe eczema, they might need more medical treatment, and that's when the doctor would prescribe certain ointments. Babies that are more likely to have this is if the parents had it when they were little, or if the parents had asthma, or they have obviously have siblings with asthma or eczema. It's thought to be there's some sort of like allergic component to this.
So this next one is heat rash. So this one also, I feel like when I look at the picture, like it scares me, but it's one of those conditions that will go by itself. Um, so it's when the baby gets too warm. So sometimes when there's like too much clothing and then the baby is like covered with like two different blankets and another like a jacket or something, like too many things on the baby. You can usually see it in on the neck, armpits, or in the diaper area. This one actually makes the baby uncomfortable. So I feel like some of these photos, when we look at it, like the baby acne was red, the erythema toxicum was red, but those, like, babies don't care about those, but the heat rash can actually make the baby uncomfortable. So keeping them actually at a comfortable temperature, taking off some of those clothes, is actually helpful. And most of the time, these prickly heat rashes will go away in a couple of days.
This next one is a diaper rash. And so diaper rashes are very, very common. The reason why they occur is just because with the baby wearing the diaper, there's excess moisture, there's some friction between the skin and the diaper itself. And then obviously, the babies are peeing and pooping very frequently. And sometimes, if the diaper is staying on too long with either the poop or the urine, that can also kind of exacerbate a rash. Um, there's more likelihood of having that rash happen if the diaper isn't being changed frequently enough. I will say that I think, I feel like almost, I don't know, like 90% of babies we see in clinic have a diaper rash. And so that's to say that babies just go to the bathroom so frequently, and it can be so hard just to keep up with constantly changing the diaper. And so we totally understand that and is very okay. What we recommend when a diaper rash happens is, if possible, to have some periods during the day where the baby's not wearing anything at all. Obviously, that's hard too, because then wherever, blanket or floor, then they're peeing and pooping on that area and you have to clean it. But that's kind of in an ideal situation. And then also using just warm water and gentle cleanser in that area. Something that can be helpful is a barrier cream. There's lots of different barrier creams out there. The one that we often recommend is called zinc oxide. And basically, what that does is you put that cream in the diaper area. And so it's creating a barrier between the diaper itself. So if there's any friction, it kind of minimizes that friction. And it's creating a barrier between any like stool and urine that's going to be there. Sometimes the diaper rash can get pretty severe. You can see kind of the progression in the image at the top of the slide. If that happens, it's possible that you might need topical steroids. And it's possible that it might progress to becoming an infection. At the very beginning, the redness that you see, it's not an infection, but it can progress there if it's not treated. The way that you know if it's an infection is, one, obviously your doctor can always help this, but usually the diaper rash, it's one rash, like one confluent rash. It's not kind of in patches. If you start to notice that there's some patches that are not attached to the main rash, that usually clues us in that a fungal infection called Candida has developed. And if that does develop, then they need an antifungal treatment. We often give nystatin. And sometimes bacterial infections can develop too, but usually if it's like one confluent rash with not kind of extra rashes around it, it's probably just a diaper rash. Another treatment that we kind of already talked about for cradle cap is breast milk. Like I had mentioned, breast milk has really great antimicrobial properties, and so it's something that can help as well. And I see in the chat a question about, or comment about Vaseline, which, yeah, is great because Vaseline is so thick, which is why it's great for eczema and for the diaper rash. Unfortunately, I think a lot of people use powder, and the you might be thinking of actually the nystatin powder because that's pretty common, but just kind of regular baby powder can help absorb some of that moisture, but it's not as thick as something like Vaseline or the zinc oxide ointment.
Okay, any questions? I'm gonna stop sharing my screen and we are happy to have discussions, questions.
Any questions, guys, comments? Yes. So, doctors, I recently came across something like getting ready for this session. One of our boys has had extreme eczema since he was small, and even now he does have eczema, and he has flare-ups from time to time. And what I learned is that like the eczema doesn't happen like from the inside out perspective that there is for most kids who have eczema. It's from they're missing a protein in their skin that acts as a barrier to keep water inside the body. And so if that protein is not present, then they're losing what do you call water through their skin. And it's kind of like they inherited a leaky skin. So I was wondering if you can speak to that.
Yeah, absolutely. I usually like to describe eczema as if you think of like a brick wall, there's bricks and then there's the cement between the bricks. And a lot of people with eczema, they're missing the cement that's between the bricks. So just like you mentioned, it's kind of it's leaky is the best way to describe it. And so by putting something like a thick moisturizer like Vaseline kind of over that brick layer, you're helping prevent other things, other triggers that are going to flare it.
Yeah.
Yeah. And I see a question in the chat about if someone is possible to outgrow their eczema. I would say, and Tara, please let me know if your experience is different. I feel like for most people, they kind of have eczema throughout their life, but if you kind of use this good moisturizer early on, it can kind of lessen the amount of flares later in life. But typically, I think it's something that like it's always when you're older, it's possible that something will trigger it later on in life.
I was just gonna add to what both Zainab and Seema said. So I love that description of the cement. That's really nice. I also just wanted to say like it's eczema is one of those immune conditions. So like your immune system is different. So you have like more inflammation. So you're right, Zainab, that you have this and it's just not gonna go away, but like it's like how you control it and how you manage it. And yes, as like people who really like can control their eczema, they won't have a lot of these flares. So it's better controlled, but it doesn't just go away. One thing that I can say, if we just go back and look at a lot of these photos, a lot of rashes look similar. So it is possible that like someone has been told that they have eczema, but it wasn't eczema. And yes, they outgrow that, whatever that was. And they're like, oh, I had eczema as a kid. I don't have eczema. So it's probably something that looked like some other condition. And yes, Zainab, you can get eczema as an adult. It's just you have developed it then because your immune system has changed or you have like more inflammation. So you're going to see those signs and symptoms later in life.
Mm-hmm. Yeah, and speaking of inflammation, I do believe that for most kids, eczema and allergies kind of go hand in hand, just like asthma. And one of the things they were saying is with allergies, it's more like the late food introduction for kids, and we're not doing it as early enough, but then we give their skin this opportunity to kind of develop the eczema because we're waiting until like they're 2 years old to introduce foods like peanuts and things like that, where if you introduce it in the gut, it would have more like it would give you your ability to fight off infections and kind of introduce it to your body the right way, as opposed to just doing it through your skin when you don't have that skin barrier. Mm-hmm.
Yeah, absolutely. And just to kind of expand a little bit, that like eczema is definitely way more common in kids. than it is in adults. And so I think if you have a baby that has eczema, they might have more frequent flares when they're younger, and then as they become older, it won't flare up as much, and then it is not contagious. To have the eczema is not contagious. And yeah, absolutely, about kind of the food introductions, because we think eczema is related to allergies. There used to, a while ago, used to be this sense of like, oh, like, these are common allergic foods. We don't want to introduce the baby until they're a bit older. But what we've learned over time is that actually exposing them earlier on is the best way to prevent them from having an allergy. So as early as, honestly, like 4 months, whenever the baby's able to really support their head well, we recommend introducing some solid foods, and even starting with the ones that have this, that are more likely to be have an allergic component. And if either someone has like very severe eczema or a significant history of allergy, you can even take the baby to like an allergy office and have them try it there for the first time. And in case they have an allergic reaction, then the allergy team is right there to kind of address the situation.
Just wondering, eczema and asthma, like, is there a link, or is it just kind of like hit and miss and depends on the individual with that one?
I think both you and Seema mentioned this.
At the same
Oh,
time.
oh no, no, no. I didn't mean. Someone asked a question and you asked a question, but also Seema at some point was saying like there is an association with like allergy, asthma, eczema. So you see those conditions in, like someone who has eczema, it is possible that they also have other allergies. It's also very high association between like that and having asthma. It's just because they are all some type of immune response and some type of inflammation that causes these type of immune responses. So there is definitely an association. So like a lot of times, when someone comes, like an older kid, like a 7-year-old, a 5-year-old, like some of the questions that we ask is like, do they have allergies? Do they have like, eczema? Is like, are allergies, eczema, or asthma something that you see in other members of the family? So there is definitely some genetic component to these, and there is definitely an association with all of these.
And I know we didn't touch on like teenage, what do you call it, skin conditions, but if you can speak to a little bit like teenage acne, and also I know that some women get acne like during their cycles, if you can explain that a little bit.
Yeah, acne, I think both for teenage and for women during their menstrual cycle is related to just a lot of the hormones that are in our body. For teenagers that are going through puberty and that have kind of this like surge in their testosterone levels, that can certainly cause acne to happen. It's not related to like hygiene. It's usually just related to an increase in these hormones, which cause more kind of oil to build up, and then they kind of clog the pores, and that's kind of what you see as the pimple. The recommendations that we have usually for mild acne are kind of just using a gentle cleanser and trying to avoid very like fragranted lotions or cleansers, just kind of using a gentle cleanser with a normal kind of what we call like a pH level, like the acidity level of the cleanser is similar to your own natural acidity of your skin, so that it's not triggering any type of infection. And then if the acne is really severe, either in a teenager, there are like strong medicines that can be prescribed to help it, but they do have some adverse side effects. So we usually, if it's very mild, don't prescribe those stronger medicines like the retinoids.
And it's interesting because oh, sorry, Zainab, you are on mute.
No, please go ahead. Finish your thought, doctor. I'll remember.
I just wanted to say, like, it's interesting because like our hormone levels throughout our life changes. So like you see like a 12-year-old or 15-year-old who are like really annoyed with the acne because they're getting that, and then they grow out of it at like when they're like in their 20s. It's because like our bodies change as we age and our hormone levels change.
Yes. And with what was I going to say? Just like the cleaning, I guess, for babies, what would you recommend? I know like no harsh shampoos and things like that, or their body washes, but just when moms are asked to kind of apply as far as application goes, like lotions and things like that, what would you recommend? I know you talked about the moisturizer.
Yeah, we usually recommend anything that is like unscented. So things like Vaseline, which we talked about, or Aquifer can be really great. And then same thing for the cleanser for like a lot of the rashes we talked about, even though like the acne looks like these bumps, there's no need to like scrub anything. It's really just kind of giving a normal bath. And then one thing that can be helpful to look at for whatever lotion or body wash or anything that you're buying is just looking kind of at the ingredient list, and also looking at what the pH of it is. We want something that kind of matches the pH of our body, and typically most unscented like baby friendly lotions and Vaselines will work just great.
All the allergenic stuff. Mhm.
Yeah.
And I know some things, like some moms sort of gravitate towards things that are considered, what do you call clean beauty and kind of natural, and not all those things are good for your baby's skin because they contain like essential oils and things like that. And so should be use only gentle things on the baby's body. Mhm.
Yeah, I feel like there's a lot of kind of fancy products out there for babies and for everyone, but really the best thing are kind of a lot of excuse me, a lot of these simple lotions and body washes like the Vaseline Aquifer, like um Aveeno, kind of, yeah, the more simple ones are what we recommend more than these like kind of fancier ones that tend to have kind of other ingredients in there that the baby doesn't really need.
That's right. Any other questions, guys? And no, you should not, you shouldn't like mess with your pimples, like you shouldn't pop them, right? And just because if you do, I heard that they actually just kind of regrow in other areas, and yeah.
It's very satisfying, but no.
That's right. Okay, cool. Eucerin, Aveeno, definitely. I remember when I found Neosporin. Then now there's a lot of companies producing things like what they have eczema essentials. So that was really helpful for my son. It said it would work within the first 3 days, and it was really nice. So yeah, cool.
Yeah, I'm curious if other people who have kids either with eczema or acne, kind of what if there's things that have worked well for you.
One thing that I don't have kids. Seema, that was not your your answer. Someone just answered in our chat. But something that was interesting is like there are a lot of fancy detergents for like washing baby clothes and stuff, and those can also cause eczema and reactions. So I personally also would go on the side of unscented or hypoallergen ones.
Oh, I haven't heard it. Fatima, is that for eczema? The tubby Todd? Mm. Okay. Yeah, I'm writing these down because I want to try them too. Okay, thank you. Mm. Okay. Well, thank you for sharing. Any more questions, guys? Comments? And I was just thinking about it earlier. This is like our last session before the new year. So it's like, wow, really? So next time, whoever is going to be joining us will be a new year. So 2024 session, which is exciting. Okay. No more
I
questions.
didn't even realize we are
Oh my
there.
goodness.
It's
Yeah.
December.
Oh yeah. Yeah, absolutely. Yeah. Okay. Well, thank you so much for coming, you guys. Please, I will upload the video soon to our YouTube channel. And please sign up for the stipend. I dropped the link in the chat box. And I just want to thank our great doctors for joining us today. Nice to meet you. This is very informative, fruitful session. Thank you both for coming. Nice to meet you.
It was a
Thank you so
pleasure
much
for us. Have a
having
great
us.
one. Thank you for having us.
Absolutely. Thank you for coming. Have a good night.
Bye.
Yes.